Hello, I'm David Williams from HSJ, and I'm going to be talking to you about continuing healthcare and what happened to the money the NHS set aside to pay for it. In 2012-13, it became clear that primary care trusts might have to make payments to families who were retrospectively claiming for continuing healthcare, known in the NHS as CHC. A flood of historic CHC claims came in during that year, at the same time as PCTs were preparing to be abolished and replaced with clinical commissioning groups. Complicating the issue, the then Health Secretary Andrew Lansley had assured the embryonic CCGs that they would be starting with a clean sheet. The phrase floating around at the time was that they would have no legacy debts. To deal with this, PCTs made provisions worth £800 million during 2012-13. £650 million of that was specifically for continuing healthcare. The accountancy around this is fiendishly complicated, and there are arguments over whether these provisions were ever real money or not. But the important facts are these. People who were in PCTs at the time say that to make these provisions, they had to hold back money that they would otherwise have spent on other things. At the end of the year, the money set aside in provisions showed up in the Department of Health accounts as money not spent, and as such, the provisions contributed to a £1.5 billion underspend against its revenue budget for the year. That £1.5 billion formed part of a £2.2 billion surplus which was handed back to the Treasury. The Treasury used that DH surplus to help in wider fiscal deficit reduction. So in effect, the total £800 million PCT provisions were top-sliced from the NHS budget to cut the deficit. Although the DH accounts say that the surplus is not lost to the NHS England now has confirmed that PCT provisions can't be accessed by CCGs. That means in 2014-15, next year, the NHS budget is going to have to be top-sliced again to pay for the same CHC claims. CCGs are unhappy that overall they will lose £250 million as a result. That's 0.4% of their budgets each. And, CCGs point out, that as some of them only get the bare minimum funding increase to keep them in line with inflation, once you factor in the top slice, that makes a real terms cut for the NHS budget in some areas.